Hello, I'm Wellprepared-kun. Today, let's learn about the absolute basics of infection control. When having a conversation, there are times when we get excited and our voices get loud or we touch each other. Infections can also occur in these situations. The infection route of COVID-19 is mainly droplet infection and contact infection. Droplet infection occurs when droplets that are dispersed when people cough, sneeze, or speak loudly enter the body from the mouth and nose. As in the previous scene, talking at a close distance without wearing a face mask can often cause infections. Contact infection occurs when you touch your mouth, nose, or eyes with hands that have viruses stuck to them. When having a conversation, droplets could stick to hands and clothes. When you touch someone, droplets that contain viruses could stick to your hands, and if you eat, touch your nose, or rub your eyes with that hand, you could get infected. It is said that doorknobs, handrails, and switches that many people touch are also parts that often cause contact infection. Infection often occurs in the 3 C's, which are crowded places, closed spaces, and close contact settings. Additionally, it is said that during meals and conversations without masks, the risk of infection increases. For example, when going on a date with Oopsie Daisy-chan, if you talk while you eat together, seated next to each other in a room with poor ventilation, it could increase the risk of infection. Such dates are very fun, but not good in terms of infection control. Now, let's look at the points of what we can do to prevent infections. Number 1. Avoid the 3 C's. To avoid crowded places, closed spaces, and close contact settings, try to avoid crowds. Enable adequate ventilation and keep your distance from others. It is best to try keeping a distance of about 2 meters. Number 2. Always wear a face mask. If you talk, cough, or sneeze without a mask, droplets will disperse. Always wear a mask and try not to disperse droplets. Closely cover your mouth and nose with a mask so that there are no gaps. The proper way to put on a face mask is explained in another video. Number 3. Frequently wash your hands and gargle and sanitize your hands and fingers with alcohol. To rinse away viruses on your hands, frequently wash your hands and gargle. When you can't wash your hands promptly, sanitizing your hands and fingers with alcohol is also effective. Please see another video for the proper way to wash your hands and gargle and sanitize your hands and fingers with alcohol. Today's precautionary measures. Number 1. Avoid the 3 C's. Number 2. Always wear a face mask. Number 3. Frequently wash your hands and gargle and sanitize your hands and fingers with alcohol. Be prepared and have no regrets. Welcome to Araba! Let's all take thorough countermeasures against infections.